New data confirms that a breakthrough melanoma treatment is having life-saving impacts, with long-term control achieved for over 50% of patients at advanced stages of the condition. Melanoma is one of Australia's most common and deadly cancers. Professor Georgina Long is the Medical Director of the Melanoma Institute Australia, and she joins us now. Very good to see you, Georgina. So can you tell us more about the survival rates this new treatment has achieved?
Sure. Thank you for having me to speak about this Australian trial. This was a trial that was conducted only in Australia. And what we showed, these are the updated results now at 7 years, that when patients had 2 immunotherapies together versus 1, where they had melanoma that had spread to the brain, and normally those patients would survive 16 weeks, they are now cured in over 50% of patients. It's phenomenal, but when we first published the initial results in 2018, the first patient recruited to this trial was in 2014, it changed clinical practice overnight across the world. So to have these confirmatory long-term overall survival results, it really confirms that cure rate, dare we say it, don't like to use that word in oncology, but that's certainly what we're seeing. So I'm very proud of this Australian trial that was conducted at Melanoma Institute Australia, designed here and opened in Victoria, Queensland and South Australia. And it really does talk to the importance of research and clinical trials to make these drugs available for all Australians with melanoma, advanced melanoma that had spread to the brain. And indeed, those drugs are available.
That's incredible to go from advanced melanoma, where it's spread, as you say, to the brain, where patients are terminal, to then being cured. What sort of time frame are we looking at? How long does it take this treatment to get from those really severe conditions to being, as you say, cured?
So it's variable. Everybody is different. It is an immune treatment. So the way it works is to stimulate the immune system in a very specific way to kill the cancer cells. For some patients, we will see results clinically, meaning they're feeling better within 6 weeks. And for others, it might take a little longer. Generally, by about 3 months, we start to truly see it on scans. And by 6 months, it's very clear. But if you're in the group of patients that respond very early and very quickly, we know very early on that they're cured. And we can say that within the first 3 months of them meeting me, for example. So it really does show the power of Australian research and Australian trials. We've still got more work to do. There are patients who are still dying every week in my clinics from advanced melanoma. And so we're working very hard in that group of patients to find treatments for them.
Do we know why some patients respond so well to this particular treatment?
We do know a little bit about that. We've been doing research now for many years, over a decade, on what drives response. And it seems that the tumours where the immune system has recognised it but just can't kill the cancer, we have more of a chance of curing it with immunotherapy. And there are some signs we can see in the actual melanoma itself that tell us that the immune system has recognized it but not been able to mount a kill against the cancer cells. Those patients tend to do better with immunotherapy. And funnily enough, it's also those melanomas that have that chronic sun damage around the melanoma that have all these abnormalities that make it easier for the immune system to kill. But having said that, prevention is better than having to go through drug treatments, the stress, the risk of side effects, the coming back to clinic every 3 to 4 weeks for many years, lots of scans. Let's prevent melanoma altogether. It is Australia's cancer. We have the highest incidence in the world, as you mentioned before. Someone's diagnosed every 30 minutes with melanoma, and someone dies every 6 hours in Australia. Most of the melanoma is caused from the sun. So prevention is the way to go, sun safety. So let's not get the disease in the first place. So put on your hat, sunglasses, wear good clothes that cover your skin, seek shade. And lastly, any areas of skin that are exposed, use sunscreen. That is the best way to protect yourself from melanoma.
Georgina, is this treatment then and these results transferable to other types of cancers?
But that's a good point. Yes, in fact, it was in melanoma first where immunotherapies showed that they could work. In fact, for more than 50 years, we've been working in melanoma, long before I was in the field, trying to leverage the immune system, but it's only been in the last decade or so that we've really been able to do that. What's done in melanoma first then gets translated to other cancers. And indeed, we've seen that. The treatments we use in melanoma are now used in lung cancer, kidney cancer, head and neck cancer, bladder cancer, many, many other cancers. But the work was first done in melanoma.